Hello, I'm Dr. Rosemary Scalera-Moser with the Sports Neuropsychology Society. Today I'm going to answer the question, what is a sports concussion? A sports concussion is a traumatic brain injury, and it happens when an athlete experiences or sustains a strong blow to either the head or any other body part that then transmits a force to the brain, shaking it up and shaking those neurons or nerve cells and connections. A number of immediate signs and symptoms can happen as a result of that. Things such as feeling dazed or confused, having memory problems, feeling nauseous, tired and fatigued, a headache, visual problems, or hearing issues. So anything can happen as a result of shaking up that brain. When you suspect, and I say suspect, that a player has sustained a concussion, they need to be pulled off the court, the field, the rink, etc., and they need to rest and then be seen as soon as possible by a licensed healthcare professional with expertise in sports concussion. That's really important because a player should not return to play until they've been medically cleared. If they return to play too soon and sustain another hit or blow, that can result in a longer recovery period and more complications with the concussion. So what do you do if you've sustained a concussion? As I said, contact and be examined by a licensed healthcare professional with expertise in sports concussion. And in the acute period, rest. That means the period following the concussion, rest from a thinking cognitive point of view, as well as from a physical activity point of view. Now, I'm not saying cocoon rest. Do not get a blindfold and stick yourself in a closet or something. No. Cocoon rest. If I did cocoon rest, I would be experiencing symptoms that look like concussion. Okay, no. Reasonable rest and refraining from physical activity and cognitive work activity. After that acute period, however, we want to transition you or the athlete into some paced, gradual physical activity reconditioning, which is really important for athletes. Again, this should be supervised and done under the care of a sports concussion specialist. Then with that paced activity, we can start introducing, of course, return to work, school, and eventually return to play. Now, there are many factors that can affect recovery or the length of recovery. We think factors such as whether you've had a history of migraines or headaches, some genetic factors, gender, there may be differences between males and females in how they recover. So there are many other factors that we're just learning about, but there's so much about concussion that we still don't know. What we do know is that each concussion is unique, as each individual is unique. So we can't predict that, yes, you'll recover in a week or 2 weeks or a month or whatever. We don't know. And so each treatment plan for each individual should be different. For children, we know that it takes them longer to recover. It could be a month of symptoms, and that is not abnormal. For some individuals, they may have persistent symptoms that continue for quite a while. And again, it's very important to work with a sports concussion specialist who can steer you in the right direction, whether you might need some physical therapy or some counseling or some medication or a neurology workup. But I want to be clear, and that is 80 to 90% of concussions recover completely without complications. And many individuals with multiple concussions do not have long-lasting effects. So it's really important to understand this because sometimes there's misinformation out there, and people who've sustained a concussion, athletes, can become quite anxious when they don't need to be. In fact, two factors: sleep deprivation, not getting enough sleep, and anxiety. Those two factors, just by themselves, can produce symptoms that look like concussion symptoms. So it's really important for the athlete to get plenty of sleep and to not be under a lot of stress so that they can recover, and that will help their healthcare professional guide their treatment plan in a correct way. I do want to let you know that if you've not had loss of consciousness, it does not mean you haven't had a concussion. Also, if the CT scan or the neuroimaging or MRI is considered normal, that doesn't mean you haven't had a concussion. We expect those tests to be normal. For more information about this topic, or if you have questions, please comment below. And you can find a link in this video that will take you to the Sports Neuropsychology Society for more information and on how to contact us. This has just been a short introduction to sports concussion, and I hope it's been helpful. Thank you.